put on makeup today, so no glasses. We are going to go right into rehabilitation. So, I've got some pictures here from probably the 70s and 80s for you. So, enjoy. All right, so what is rehab? Basically, we want to restore an appropriate level of competitive fitness. So, that could be different. So, if we have maybe an older person that had some edema and some circulatory issues related to diabetes, that's going to be a different goal than, hey, your foot's on backwards and you want to play football again. So, going to be different patients. So, it will be it'll be dependent on the individual, the severity of the injury, the stage of tissue healing, type of treatment, sport demands, and also what the patient's willing to do. Okay, so the whole goal for this is essentially physical therapy. What are we doing after someone's injured? Well, we're going to send them on to someone who's a specialist in treating injuries and restoring function. That's a physical therapist. So they want to do it in the shortest amount of time possible while being aggressive, but without injuring more. So remember when we were in the beginning of the year, we were talking about sports psychology, and we went through DABDA. So it was denial, anger, denial, anger, bargaining, depression, and then acceptance. That's kind of the range that they go through. Sometimes you're dealing with an athlete that is in the bargaining phase, that is going, hey, if I do your physical therapy 2 times a day, can I get better twice as fast? Or sometimes we're dealing with an athlete that maybe maybe they don't really care that much about getting back. There are athletes like that. So you want to be aggressive without causing harm. You have to make it super individual, and as much as you can, you want to involve the athlete with the team. As many of you know right now, you're missing out on that sport experience, and that can be super depressing. It needs to be progressive, which means whatever the skills are, we're going to use concepts like Wolff's Law and overload, and we're going to make sure that we're just progressively getting better. And we're going to use a variety of equipment, such as, here are your 80s pictures, I'm pretty sure, such as unstable surfaces and balls and foam rollers. And oh man, so bad I want this to just flip off of her feet, just because, I mean, I don't want her to get hurt, but that would be funny. So yeah, lots of different equipment. The worst injuries I've seen are on these box jumps things, like the front of the shin. Just eats through the entire front of the shin. Good stuff. Okay, so there might be some videos that I include after. I'm not going to do it during the PowerPoint, but sometimes we might be going, okay, you have a rotator cuff issue, and so we're treating that rotator cuff issue without looking at form, without looking at whether or not they actually have a technique that needs to be corrected, because they could be throwing in a bad way, like just bad alignment all the way through. So if it's bad alignment and we go ahead and go, all right, this is how we fix your teres minor, so fixity facts, and then they go and then they go back and they throw bad again, and it's toast again. So we actually have to answer technique questions and say, like, yeah, are you doing it right? And then SMART goals. We love SMART goals. They got to be realistic. They got to be reachable with the timetable. If you ever want to read the dumbest quotes in the wide world, it's Yogi Berra that throws this together, and every sports person ever is like, he's real good. So there's a quote for you. If you don't know where you're going, you'll end up someplace else. That's all of his quotes are that dumb. But we're a sportsman, we might as well throw that in. Okay, so what we need to do after the fact. So we should probably just go with an example. So we'll say that she wrecked her ankle. So she has a cast on. We say she broke it. We'll say she broke the distal end of the fibula, And so in order to get that joint stable again, so we're working around the ankle, is we're going to have to cast it. We're going to have to give that bone time to regenerate essentially and get back to strong. So that's what the initial program component will be, is like, just let's make sure this is healing. Acute phase, we're going to do some of these things. We're going to decrease pain and inflammation first 2 to 3 days. So that's things like ice. When we start to get into modalities, they use like the shocking therapy pretty early now. It's not always after the acute. Sometimes it's right in the acute phase. So progressive PTs are doing different things. We're going to work on range of motion and flexibility. So I might have you go through some stretches in this. They'll give you some implements a lot of times in PT. They'll give you things like rubber bands, towels, and like I said, unstable surfaces to kind of work through different angles. They're going to do some muscular strength, so some resistance training. And then we're going to get into some muscular endurance. Here's the travesty tragedy. This year, I had just purchased like 2 bags worth of stuff that's like, has this in it. I've been playing with it. I brought it home because I'm like, I'm going to play with it. So you have like parachutes and you sprint and it drags you. And so we were doing like parachute races the other day because we're bored. So we took these parachutes out and we're like, ready, set, go. And it turns out my son-in-law is way faster than me. So I'm done talking about that. But you can train things like speed and muscular endurance in these phases, but it probably will be, I'm going to show you different phases in a second. Other program components, we're going to include plyometrics, so that's going to be those explosive movements, kind of jump training, power lifts. If you mix those two together, you basically get HIIT training. So if you want to, a lot of them wreck their joints, but you can do it. It depends on your body type, but it's going to go from plyometric to a power lift to plyometric to a power lift, essentially, is how they work those out. They'll do agility and coordination stuff. So now we're starting to get back into training. So we're getting back into training, but we're gonna do like training wheels first, get the training wheels off, and then we're gonna get right back to that 2-wheeler. You just gotta take it take it from their level. Okay, we want to maintain their cardiovascular endurance. So that should begin immediately. So if they broke their leg, most physical therapy places will have like a hand bike. These muscles aren't as big, but they're movers, and we can get some blood flow going. The heart will have to increase for that. But yeah, there are some different things that you can do. Get in the pool. You can get in the pool. But we want to make sure the heart and lungs are still working after you get an injury. I'm going to stop there today. If there are juniors in the room, I would like you to apply to be a HOSA officer if that's something that interests you. It's going to be a good fun time. So we got some cool Nike jackets this year, and we were going to compete and go to Texas, but then they said you can't compete because of Corona. So next year we'll compete, and I think we can go to Disney. I'm pretty sure. So sign up. Let's get the best people out there in here. So we will see you next time.